Ginger. 11 amazing, proven health benefits. Ginger is derived from a Southeast Asian flowering plant. Including ginger into your diet has several physical and mental health benefits. Ginger is one of the healthiest and tastiest spices in the world. It is closely related to turmeric, cardamom, and galangal, with which it shares the Zingiberaceae family. As a spice, the rhizome, the underground portion of the stem, is often utilized. It is commonly referred to as ginger root or just ginger. Ginger can be used fresh, dried, in oil or juice form, or as a powder. It is a common component in cooking. It is occasionally included in processed foods and cosmetics. Here are 11 health benefits of ginger, supported by scientific studies. 1. Ginger includes gingerol. Gingerol is a compound with potent therapeutic properties. Ginger has a lengthy history of use in both conventional and alternative medical practices. It has been used, among other things, to assist digestion, relieve nausea, and treat the flu and common cold. Ginger's distinctive aroma and flavor is derived from its natural oils, the most prominent of which is gingerol. This is ginger's primary bioactive component. It accounts for the majority of ginger's therapeutic effects. According to study, gingerol possesses potent anti-inflammatory and antioxidant properties. For example, it may aid in reducing oxidative stress, which is caused by an excess of free radicals in the body. 2. May alleviate numerous types of nausea, including morning sickness. Ginger may alleviate nausea and vomiting in patients undergoing specific types of surgery. Ginger may potentially assist with chemotherapy-related nausea. Yet, it may be the most effective treatment for nausea associated with pregnancy, such as morning sickness. According to a meta-analysis of 12 trials, involving 1,300 pregnant women, 1.1 to 1.5 grams of ginger can effectively alleviate nausea. Although ginger is considered safe, pregnant women should consult a physician before consuming large quantities. It is advised that pregnant women who are nearing labor, or who have experienced miscarriages, avoid ginger. 3. Effective aid for weight loss. According to studies conducted on humans and animals, ginger may contribute to weight loss. A 2019 literature analysis revealed that ginger supplementation significantly lowered body weight, waist-hip ratio, and hip ratio in overweight or obese individuals. A 2016 research of 80 obese women discovered that ginger can also reduce body mass index, BMI, and insulin levels in the blood. Elevated insulin levels in the blood are connected with obesity. Ginger has a highly good impact on obesity and weight loss, according to a 2019 assessment of the research on functional foods. In animal research, the evidence supporting ginger's effect in preventing obesity is even stronger. Rats and mice who took ginger water or ginger extract regularly experienced decreases in their body weight, even in circumstances where they'd also been fed high-fat diets. Ginger's capacity to promote weight loss may be tied to certain mechanisms, such as its capability to help improve the number of calories burned, or lower inflammation. 4. Helpful for osteoarthritis. Osteoarthritis is a widespread health issue. It is characterized by degeneration of the body's joints, resulting in joint discomfort and stiffness. According to a study of the scientific literature, persons who took ginger to treat their osteoarthritis experienced significant reductions in pain and impairment. Participants in the study received between 500 mg, mg, and 1 gram of ginger per day for 3 to 12 weeks. The majority of participants had been diagnosed with knee osteoarthritis. Most participants felt less stiffness and pain by the end of the 12 weeks. A 2011 study indicated that a mixture of topical ginger, mastic, cinnamon, and sesame oil can help lessen knee osteoarthritis patients' pain and stiffness. 5. May reduce blood sugar levels and improve cardiovascular disease risk factors. Ginger may have potent anti-diabetic benefits. In a 2015 study, including 41 people with type 2 diabetes, 2 grams of ginger powder per day decreased fasting blood sugar by 11%. In addition, hemoglobin, a measure for long-term blood sugar levels, improved considerably. The hemoglobin level decreased by 10% during the course of 12 weeks. There was also a 28% decrease in the apolipoprotein B/apolipoprotein AI ratio, and a 23% decrease in the oxidative stress byproduct, malondialdehyde, MDA. A 2019 literature analysis also indicated that ginger significantly reduced HbA1c in persons with type 2 diabetes, which is relatively hopeful news. Wow, are you still watching? That's great. Hang in there, we are halfway there. Please remember to subscribe and like. Let's continue. 6. Ginger is effective in treating persistent indigestion. Persistent indigestion is characterized by recurring discomfort and pain in the upper stomach. It is considered that delayed stomach emptying is a significant cause of indigestion. Surprisingly, ginger has been demonstrated to accelerate stomach emptying. In a tiny 2011 trial, participants with functional dyspepsia, which is indigestion, were given either ginger pills or a placebo. 1 hour later, everyone was served soup. The emptying of the stomach took 12 minutes for those who received ginger. It took 16 minutes for those receiving a placebo. Similar results were also being observed in a 2008 study. 7. May dramatically decrease menstrual discomfort. Dysmenorrhea refers to menstrual cycle-related pain. Ginger is traditionally used to relieve pain, particularly menstrual discomfort. 150 women were directed to consume ginger, or a non-steroidal anti-inflammatory medicine, for the first 3 days of their menstrual cycle, in a 2009 study. 4 daily doses of ginger powder, 250 mg, mefenamic acid, 250 mg, or ibuprofen, were administered to each of the 3 groups. 400 mg, ginger was as effective as the 2 non-steroidal, anti-inflammatory drugs in reducing pain. Recent studies have also indicated that ginger is more effective than a placebo and on par with pharmaceuticals like acetaminophen, caffeine, ibuprofen, and mefenamic acid. 8. May assist in reducing cholesterol levels. High levels of LDL, bad cholesterol, are associated with an increased risk of developing cardiovascular disease. In a 2018 study of 60 individuals with hyperlipidemia, the LDL cholesterol levels of the 30 participants, who got 5 grams of ginger paste powder daily, decreased by 17.4% over a 3-month period. In an older trial from 2008, participants who took 3 grams of ginger powder per day in capsule form likewise experienced significant decreases in the majority of cholesterol indicators. In 45 days, their LDL cholesterol levels decreased by 10%. Similar to the cholesterol-lowering medication atorvastatin, ginger extract reduced LDL cholesterol levels. In addition, the participants in the 2008 study experienced a drop in blood triglycerides. 9. Includes a chemical that may aid in cancer prevention. Ginger has been investigated as a potential alternative treatment for various types of cancer. Gingerol, which is abundant in raw ginger, is responsible for raw ginger's anti-cancer benefits. The version known as 6-gingerol is regarded as particularly potent. In a 28-day study of people at average risk for colorectal cancer, 2 grams of ginger extract per day significantly decreased pro-inflammatory signaling molecules in the colon. Ginger may be beneficial against other gastrointestinal malignancies, such as pancreatic and liver cancer. It may also be useful against ovarian and breast cancer. 10. May enhance cognitive performance and protect against Alzheimer's disease. The aging process is accelerated by oxidative damage and chronic inflammation. It is considered that they are among the primary causes of Alzheimer's disease and age-related cognitive decline. A number of animal studies suggest that the antioxidants and bioactive components in ginger can decrease brain inflammation. There is also evidence that ginger can directly improve brain function. In a 2012 research of healthy middle-aged women, ginger extract was found to increase reaction time and working memory when taken daily. In addition, multiple studies indicate that ginger helps protect against age-related cognitive deterioration. 11. May aid in combating infections. Gingerol can reduce the likelihood of an infection. Ginger extract can actually suppress the growth of numerous types of bacteria. A 2008 study found that it is highly efficient against the oral germs linked to gingivitis and periodontitis. Both of these are inflammatory gum disorders. The respiratory syncytial virus, RSV, a major cause of respiratory illnesses, may also be combated by fresh ginger. Ginger may aid in combating harmful germs and viruses, hence reducing your chance of infection. Wow, you made it, good for you, we have almost reached the end. One more minute, I promise. Please subscribe before you leave. So, ginger is an incredibly powerful superfood, with a host of proven health benefits. From reducing inflammation and improving digestion, to boosting the immune system and fighting cancer, ginger is a versatile ingredient that can be used to improve overall health. Whether you're using it in its raw form or as an ingredient in your favorite recipes, it's easy to incorporate ginger into your diet. With its many health benefits, it's no wonder why so many people are turning to this natural remedy for their health needs. Eat ginger. Thanks for watching. Please subscribe and like.